life of your scope, okay? And so what I mean by that is just to watch out for certain things that are common mistakes that can damage the scope. Number one is this scope's really long. It's 140 centimeters. Most scopes are about 110. And so we make it longer for large breed dogs, but the thing is there's a little camera here in the tip, and that's the expensive part. So always make sure you have a good grip on this part of the scope. When you're carrying it, hold it above your eyebrows, because otherwise if you don't, it could lay on the floor and you can accidentally step on it. So I've seen that a number of times. Or just dangles and it hits the floor.
I can imagine it would just get hit.
Number two is the scope is a very small diameter. We made it that way with the help of Todd Tams and Dave Tweet designing it, so that you can use this scope on a lot of small dogs and cats. But it has a 2.8 millimeter channel, so it's 7.9 outer diameter, 2.8 millimeter channel. That channel, if you can see, that takes up a lot of space in there, so we had to make everything else smaller. The air-water channels are smaller than most scopes. The deflection cables are a smaller gauge, so you have to handle this with a little more care than you would scopes that you might have been used to in the past. So, number one thing, if it's deflected like this and you try and pass the biopsy forceps or grasping forceps, you may make it a couple times, but eventually it will tear. Okay, so when you're putting the biopsy in, if you meet resistance, just stop. And then when this L on the handle and the U are up by these red and blue buttons, it's relatively neutral. You can pass the forceps, and then once you see them come out on the screen, then go ahead and deflect them any way you want and take bites. Something recently that the
You said you could, once it's passed,
yep,
then it's
deflect
okay.
any way you want.
Okay.
Yeah, and you don't have to straighten it to pull it out. It's just going in. Okay. And where that happens a lot is flipping behind the soft palate of an animal. They get that great view and they don't want to give it up, so they keep going in and with the forceps, but it'll cause some damage to the channel. So yeah, anytime you meet resistance, just stop. And then there was one other thing I was going to say about that. That'll come to me eventually. All right, and then the next way, this little gray button at the tip of the scope, there's a tiny little hole that comes out the side, and that's where the air and the water come out, right in that little gray button.
They are
There's
so
a tiny
small.
little hole that goes out that way across the lens. When you're done a procedure, as soon as you're done, just press down on the blue button and rub your thumb or a piece of gauze across the tip to clean the tip of the scope. Because if you don't, and you just hang the scope up and recover the patient, any mucus or food or whatever, or blood that's on the tip of this scope, when you turn off the machine, the pressure in the bottle subsides, and that mucus or whatever will get sucked into that air-water channel, and it'll dry and it'll clog the scope. So just that simple thing of rubbing the tip of it will knock out 99% of your clogs. Okay, and also it's important to always have a nice clear image. If you don't, flush the lens, because if you don't have a clear image, it's because mucus is on the tip of the lens, and again, the heat of the lamp and stuff will dry that on and clog your channel. So.
And when you say press down on the button to clean it off, do you mean this blue button right here or this guy?
The big blue button.
Okay.
Yep, exactly. Okay.
You could even dip that gauze in a little bit of like diluted enzymatic cleaner.
Okay.
That might push you even further into the 99.9 range.
And then back to the smaller gauge wires. Another thing is, even in just your setup and how you're approaching the animal, and this was just brought to my attention recently, we were trying to troubleshoot why someone kept having broken cables. You want to have this nice U shape when you're going to start a procedure. If you have this, as you get closer, or as you get down the esophagus and stomach, that knot gets tighter, or that loop gets tighter, and that puts a lot of strain on the cables itself. Similarly, if you have this is a nice height table. We were working on a table that was real high, and they were holding it way down here, but putting the scope up here, and again, creating a tough angle. So the less strain you put on this section back here, the better in terms of preventing broken cables. All right? And then last but not least, in the attempt to prevent a broken cable, when you have the tip of the scope in the tissue and you get that red out on the screen, a lot of times people start cranking on the knobs trying to find their way out. Well, if the tip of the scope is buried in tissue and you're trying to crank on the knobs, tip has nowhere to go, and it will, if you're cranking hard, it can break a cable. So just if that happens, you get that red out, just back up until you can see something on the screen. Then go ahead and deflect your knobs. All right? So there is the damage protection lecture as witnessed or experienced acutely by Mike Bateman over the 20 years of experience. So
Appreciate it.
so now we can stop that.